I'm Lisa Best, and you've just tuned in to the Perfect Diet for You webinar. And I'm so excited that you're here with me today. Before we get going, let's talk a little bit about how Zoom works. Um, First off, I've got your sound and video muted, so I can't see or hear you. So please feel free to make all the noise you want. I won't hear it. But there is a chat button at the bottom of your screen. And if you click that and then type into the screen, you can communicate with me all through the webinar. And I'm encouraging you to do that. I'd love to have your feedback, not only on whether your sound and video are working, but also if I need to clarify any points with you as we're going through or answer any questions. I'd love to interact with you all the way through this program. I'll also have some question and answer session at the end as well. So I want to allow a little more time for people to join us. So while we're waiting, let's talk a little bit about holistic nutrition and what that means. You hear the word holism or holistic medicine kind of bandied around all the time, and I want to be sure we're on the same page when we start talking about this. So the definition of holistic nutrition is whole or holism, and that's exactly what it means. It means we're talking about how the whole fits together. So on the most simplified or basic level, we can talk about how individual organs or parts of your body fit together. In mainstream medicine now, everyone's a specialist. So if you go to a cardiologist, they're going to know about your heart and know a lot about your heart, but they may not know anything about how your brain might be affecting your heart or how your gut may be affecting your brain. So with the holistic approach, what we're trying to do is definitely look at not only how each organ functions, but how they interact dynamically with other organs and how they all work synergistically together. So that's one way of thinking about holism or holistic medicine. The second way would also include the interconnectedness of mind, body, and spirit. Um, I think particularly when you're looking at eating disorders or special diets, if you're not looking at the emotional impact of your feelings and things that might be going on in with your emotions, you're missing a big part of what may be going wrong. So we definitely want to look at the emotional impact of what you be doing. And so many of us actually use the spiritual strength to help us heal and to help us move through the difficulties of dealing with an illness. So we don't want to miss out on the power of the connection between mind, body, and spirit as well. And probably the most important tenet to me of holistic medicine is looking at the root cause of your illness. If you go to a doctor now and ask them, well, why do I have cancer? What has happened to my body that now my joints hurt? Most of the time, what your answer is going to be is, well, we don't really know. We don't know what causes that, but we have a treatment or a protocol to help you with it. And so let's just do that. So that tends to be the approach in medicine now. And I think it's almost impossible to get true healing unless you go and find what actually caused these symptoms to happen in the first place and then remove that cause so that you can actually get a true healing. So when I start working with patients in my practice, that's the first thing I do. I put on my detective hat. I start looking for what are all the things that could be contributing or causing these symptoms that you're having. And it's a long process. It's detailed. It takes a lot of time and a lot of trial and error. So I understand why people don't want to do it. It's an effort. It takes time, but the payoff is so worth it. And I think that really is the only way to get true healing in medicine and nutrition and anything. So that'll be the approach that we'll be talking about all the way through the protocols that we discussed today. So I think we've given enough time for everybody to join us. Let's go ahead and start now with our PowerPoint presentation. All right, so today we're going to be talking about the perfect diet for you. And my company name's Healing with Nutrition, and we're going to be referencing a book that I use very, very frequently called Diet Wise. It's one of the best I've ever seen for helping find where your food sensitivities or allergies might be. We have a lot of other protocols that I use for specific cancer diets or treatments for Alzheimer's or any specific disease you have. There's protocols for everything, but those will probably be in future webinars or at a future time to discuss. But today we're going to be talking about diet wise. And this is me, Lisa Best, and I've been with Healing with Nutrition for about 6 years. And what motivated me to do this webinar in the first place is a few weeks back, I did a survey with Health Tips Weekly. Most of you that are online today are subscribers to Health Tips Weekly and also the app Health Tip of the Day. So I did a survey a few weeks ago and asked what topics you would find irresistible for a seminar or webinar. And what you responded, and I got over 100 responses to this. It was really good. What you responded is that you're concerned about your chronic diseases and inflammation that arises with a lot of them, particularly cardiovascular disease, autoimmune diseases, cancer, diabetes, hypertension. And you were curious about what you could do with diet to help improve those situations. So this webinar is in answer to that. And what we're specifically going to be talking about, what our objectives are today, are to look at just generally inflammatory foods. These types of foods tend to cause almost everyone to have an inflammatory reaction. And then we're also going to talk a little bit about anti-inflammatory foods. And these types of foods generally help almost everybody with their inflammatory issues. And then the last and third part of the seminar webinar is going to be about foods that work or don't work specifically for you. So let's start by talking about inflammation and how it's related to disease. And there's been tremendous research over the last 10, 15 years that back up the theory that inflammation in the body somewhere is often the root cause of almost all disease. And certainly the ones listed here, cancer, arthritis, diabetes, there's just extensive research that can relate that inflammation in the body somewhere either causes or contributes to inflammation in the body. And the thing about this inflammation is it goes all over. It can start in your stomach and intestines, esophageal airway, but it also can go in the joints, in the brain, anywhere in the body. So we're looking to find the root cause again of what may be causing this inflammation. And the number one cause, and the first thing that comes to mind when we start talking about inflammatory foods, would be fast foods and fried foods. And the reason for that is because a lot of especially fast food restaurants, reuse a lot of the oil that they fry these foods in, and it's rancid. It's damaged oil. So everything that's cooked in it has this damaged oil in it. When you eat it, it's going to affect everybody. There's hardly anybody who's not affected by the inflammatory factors in these foods. And if you remember a couple of years ago, the guy that did Super Size Me went on a 30-day diet of just McDonald's foods, and all of his biomarkers went crazy in the negative because of that. So there's plenty of evidence to support this. And the dietary guidelines, 2020 dietary guidelines, would also support that fried foods are definitely something you want to minimize if you can, and especially trans fatty acids. Other foods that are also inflammatory for almost everyone are processed foods. These are things that come in a bag, box, or can, have a label. The wonderful thing about processed foods is they have a very long shelf life, but the problem is the process of making them long-lived also tends to destroy the healthy vitamins and minerals, enzymes, and phytonutrients that is natural in a live, healthy food. And these beneficial things are replaced by preservatives, dyes, additives, moisturizers, all types of chemicals that are not natural to the body and tend to cause inflammation. The last or the next group of food types that are inflammatory for a lot of people are foods that damage or affect the gut microflora. And these foods include sugar products, genetically modified organisms, pasteurized foods, foods that contain Bt toxin like corn, gluten, casein, and milk, and sugar substitutes. And those are the foods that we have. There's enough research done to show that it affects the microflora. But there are also plenty of other uh, toxins in the environment that also damage the microflora, with antibiotics being the number one thing, because they're designed to kill everything that's small, like a microflora, including bacteria. So they tend to wipe out everything, good and bad. They don't discriminate. Another environmental hazard that affects microflora is glyphosate. Pharmaceuticals can, NSAIDs, which are ibuprofen, painkillers, protein pump inhibitors that are like Nexium, also can affect your microflora. Stress does it. Chlorine and fluorine do it, and pollutants are the other environmental factors that can affect microflora. So why is this important? Why does it matter? Why does the microbiome, microflora matter? Well, probably the last 10 or 12 years, there's been a flood of research in this area. And some of it has shown us that there's 100 trillion microbes in our body. There's way more of them than there are natural human cells. So we're actually a symbiont. We're not who we thought we are. The microbiome is a big part of who we are. And so when this is damaged, it affects all of our systems. We really are at a disadvantage when the microbiome is harmed. And the interesting thing is, a lot of the research I did for this presentation, I found that a huge percentage of the studies done on microbiome is actually being done on farm animals, on chickens and pigs and cows, because they're discovering the huge antibiotics that they're using through all of the factory farms has so destroyed their microbiome that they're more susceptible to illness. So a lot of the studies are showing when they reconstruct the microbiome of these animals, their their longevity increases and their disease rates decrease. So I found it really interesting how much study has been done on animals and how their microbiome has been damaged as well. But let's talk about the reason why the microbiome is so important. The first big bunch of research has been done on the immune system and cytokine production. Microbiome and microflora play a huge role in your immune system. And since 70% of your immune system comes from the gut, when the microbiome is damaged, the immune system's damaged too. Another big bunch of research has been done about the enteric nervous system pathway, which is basically a fancy way of saying the pathway in the gut, the nervous system in the gut. And the brain, the enteric nervous system is actually being called the second brain now in research and some of the articles, primarily because there's so much of the tissue in the brain and the enteric nervous system is the same. In fact, in embryonic tissue, it's made from the same source. So the enteric nervous system is very important to overall brain function as well. And the vagus nerve actually connects the enteric nervous system from the gut to the brain, and it's all one large system. So when you're having trouble in the gut, you may also be having trouble with brain function. And we're seeing a correlation between a lot of mental illnesses, depression, anxiety, related to the serotonin production that happens in the gut. So they're all interconnected, and when one's damaged, it affects everything. The fourth area that's relevant to the microbiome is just GI function and digestion. A tremendous amount of our digestion takes place as a result of the activities of the microbiome. So if it's been devastated or damaged or reduced, GI function decreases as well. And then the last area is DNA activation. uh, microbiome is actually crossing over and affecting our own microbiome. So let's talk a little bit about the other major area where inflammatory foods affect the function of your gut. And I'm sure you've read or heard in the mainstream now. It's almost mainstream now about leaky gut and how that operates. What you have inside the lining of your intestine is a single epithelial layer of cells, and that thin layer of cells, that one layer of cells, is the major barrier between the food that's in your gut and your bloodstream. And normally there are very tight junctions that are holding each of the cells closed so particles cannot pass through. But when you eat a lot of inflammatory foods or are exposed to environmental inflammatory toxins, these that thin layer gets damaged and the tight junctions break. And what happens then is that uh, food particles can move directly from the intestine into the bloodstream. And when that happens, the food is not supposed to be there. And that triggers an inflammatory response or an allergic response in the body because your body, being the wonderful soldier, the miraculous thing that it is, says, uh-oh, wait a minute, these foods are not supposed to be here. We've got to do something about it. So that is what triggers an immune response and then can also facilitate or contribute to autoimmune disease. So when I'm working with patients, one of the first things I do is start looking at protocols to heal any signs of leaky gut because that's going to be key to stopping food allergies and food sensitivities as they continue. So now let's talk a little bit about anti-inflammatory foods. Um, the easiest way to describe them is to say that they are real foods. These are single item, natural, hopefully organic, not contaminated with pesticides and herbicides and other items that um, could be inflammatory. And they are easy to describe as a single food as opposed to a list of um, ingredients. And some of the top anti-inflammatory spices. There are many, many, many of them. Herbalists have been using them for years, but I wanted to keep it to just four that I thought people might be able to recognize. The first is cloves. The second there is ginger, and then there's rosemary, and turmeric is probably the most widely known, the fourth one. Um, and if you're interested at all in learning more about these, that is something we talk about a lot in individual consultations. So, to sum it all up, in general, for most people, if you're looking at foods that are inflammatory, the most common ones would be gluten, processed oils, fried foods, processed meats, fast food, syrups, and processed sugar. And more common anti-inflammatory foods are going to be whole, natural nuts, avocados, cherries, fruits and vegetables, olive oil, and foods in those categories. And let me just say too that any move that you make in terms of reducing the inflammatory foods and increasing your anti-inflammatory foods is perfect. We don't expect perfection and people to completely drop all inflammatory foods and adapt all anti-inflammatory foods. But any move you make, any baby step you make in that direction is helpful when you're trying to reduce systemic inflammation. Okay, so all of that being said, those were general recommendations, but we're all unique. Each one of us is different. We have our own genetic inheritance. Um, we all have different genes, different genetic backgrounds. There are different single nucleotide uh, SNPs that make us each individual, which also make it so that we might not be able to process a certain food, or we might lack an enzyme that helps us digest certain things. So that makes us all unique and different. We've also had different environmental exposures. So if you've already been exposed to an allergen or something that makes you sensitive to it, you're much more likely to continue having a reaction to it. And then there's also our personal preferences and tastes. So uh, for each of us to optimize our diet, we kind of have to explore our own individual food reactions and find out what foods work for us. There's certainly been historical cases of people being allergic to really healthy foods and not being aware of it. So it's important to explore what works for you. So at this point, I want to talk about Dr. Keith Scott Mumby's protocol that he talks about in DietWise for attacking and figuring out which foods are perfect for you. So I'm going to turn him on now and let you hear what he has to say.
Dr. Keith here. I was known back in the 80s as the world's #1 allergy detective, mostly food allergies, I've got to say. I was part of a small band, pioneer band of doctors around the world, very few of us, less than 10 doing it, I think, full time for a living back in those days. And we really got to grips with just how important food intolerance and food allergy reactions are. They can be highly inflammatory and they can produce tremendous changes in a person's health. And what we came to realize was a very interesting principle of nutrition. See, most people think of bad nutrition as things you're missing, that you're not getting, but you need them. And what we found was it's far more important things that you're eating that you shouldn't be, the opposite vector. And we used to call that food allergies. These days we've got smarter, we understand it's more complex than that. It has to do with things like leaky gut, things appearing in the bloodstream that shouldn't, and what we call delayed hypersensitivity responses, and rather more complex mechanisms, of which by far the most important is bowel flora, the microbiome down in your gut. Modern research in the last 10 years or so has shown that changing your diet within 6 hours will produce a change in your bowel flora. So when we used to say things like give up wheat or dairy and the person got well very quickly, often really dramatically, and we look pretty good as doctors, but in fact it was probably more to do with the fact that the bowel flora changed quite quickly. And so they felt better. And if the person went back to eating wheat and dairy, very quickly the disturbed microbiome reappeared. Anyway, those were great pioneer days. The story is much more widely known now, although I think there's still far too much emphasis on casein and gluten. It can be anything. For example, I had a child who was very allergic to anything from the carrot family. Carrots, celery, parsnip. That family of foods would cause epilepsy in this child. Another woman was sick nearly unto death with allergy to lettuce. She was really sick and had colitis and blood in her stools. Because she was so sick, she kept eating salad. She was conscientious. I'll eat healthy food, I'll eat good salads. But in fact, the only food that made her ill was lettuce, which is quite surprising to many. Not to me, because the lettuce family, the composites, can be quite strong. There are mustards in that family. So changing what you eat is of great importance. And as I said, in those days, what we found was so important was not what you're missing that you should be having, but more a question of what you're having that you shouldn't be having. And if you concentrate on that, you can get far bigger shifts in health issues and health emphasis. Big improvement. Now, I'm recording this video from my good friend Lisa Best. Lisa really is the best. She's got this story. She understands it. She works directly out of my book, DietWise, so I know she's on the case, and you can trust her. Lisa knows what she's doing. All right, thank you. Take care.
Okay, thank you, Dr. Keith. There have been a lot of studies done on protocols to help with finding your allergies, but I have been very drawn to this book because it seems to cover some ideas that are not in other books or other studies. And the one thing about Dr. Keith is he starts researching a subject in the Dark Ages. He goes back as far as historical writings go, and then read everyone that has had a contribution or had a thought about a specific idea, and then he integrates all this in his brain and comes up with theories that work. And basically, that's what I'm always looking for too. So I have stayed with his book and his protocol because it really does work. What I have listed here is just a few of the physicians that Dr. Keith references in the book Diet-Wise as having made contributions to his theories and thoughts about how to implement a protocol that works to help with food allergies. Let's just talk about some of the main principles that are in Diet-Wise and what you might want to start looking at yourself if you're trying to discover your own sources of inflammation. So the first principle is that eating what you shouldn't does far more damage than eating what you should. And Dr. Keith just said that in his video as well. It is his belief that the inflammation and damage is so much greater. It causes so much inflammation that finding the foods that bother you is a key part of healing. The second axiom for him is that toxic or incompatible foods are different for everyone. Um, uh, Foods that are healthy and invigorating for me could be toxic and poisonous for you. And there is no average and there is no one size fits all. There really is only one size fits one. And some specialized diets, even certain cancer diets or specific diets, can sometimes make people worse if there's a part of it that's toxic for them that they don't understand. So when I work with patients, I try very hard to make sure that that we're looking at all of the foods that could be problematic. And finally, there's only one right diet for you. And because you know your body and your reactions better than any doctor or practitioner could, you are the highest authority in trying to figure out what diet works the best for you. So, one of the major contributions that I got from this book, Diet-Wise, is understanding how it is that sometimes allergies show up and sometimes they don't. So I want to talk a little bit about overload and threshold theory. And this applies primarily to food, but it also applies to anytime you're overloaded with stress, anxiety, illness, and then on top of that, food sensitivities. So it gives a good comprehensive view of how it is that you could be affected by food. So if you look at the first small box there, it says that if you're below your threshold, which means that you're not reacting, you're not showing symptoms, you might be able to have say you're allergic to strawberries. You might be able to have a small dose, 3 or 4 strawberries, and you show no symptoms. So you think you're fine, that food doesn't bother you. But on another day, you could go strawberry picking like everybody's doing around here right now. It's the season. You might eat a pint of strawberries. And when you do that, all of a sudden you've gone beyond your threshold and you're showing symptoms like your skin's itching or your nose starts running. So it's important to understand that the dosage amount could affect whether or not you show symptoms. Other ways to overload or go beyond your threshold is to have 2 or 3 different things. Each one individually wouldn't have bothered you. Maybe you had some strawberries and then you had some milk that you're sensitive to. And it wasn't until you had the milk that you went over the threshold and then started showing symptoms. Another way that you can overload is to take several different things all at the same time. When you stress your body that much, you may see immediate symptoms from having overdone it. And then another important concept in Diet-Wise is your safe foods. And these are foods that for most of the time, they fall under your threshold. So you can eat them, you won't see symptoms, and you're fine with them. Those are called safe foods. And those are what we're looking for when we do this protocol. But another important part of this theory is you need to understand that your threshold can move. Viruses and stress, other things can make the threshold drop, in which case you may show symptoms to foods that you wouldn't normally have done because your whole threshold is lower. So, the reason we talk about this is it's so important to manage the foods that you might be allergic to. So, if you can keep your exposure to these foods that are problematic for you low enough, then you can be symptom free and basically cured. You can also understand that if you uh, push the system and overload your threshold, that's when you need to start cutting back. That's when you need to start looking for foods that could be causing this inflammation so that you can control and manage it. But the general concept of overload is important so that you can understand that you can be in control of this and you can adjust your eating to handle this overload and stay below your threshold. Okay, another important thing to understand about food sensitivities is that symptoms for food allergies can go anywhere. For me, when I'm exposed to gluten, I might get a stuffy nose. Whereas for you, you might get a migraine. So, this is the thing that frustrates mainstream medicine the most about food allergies and sensitivities because they're so used to having diseases or illnesses where you've got set symptoms, you know what the disease is, you know what the treatment is, and that's what you want to do. But with food allergies or sensitivities, not only could you have different people have different symptoms for the same cause, but the same person could also react differently at different times. You might start getting a stuffy nose in one situation or foggy mind in another, and it's all rooted in the same cause. So that is one thing that makes diagnosing this and fixing it difficult. But if you understand that, then at least you know that you're what to watch for in your symptoms. So, in the Diet Wise book, we talk about there's a continuum of symptoms or intensity of what happens with when you're exposed to foods that are toxic for you. You could just have a mild sensitivity where you see a small reaction, or it could be intermediary, or it could be very serious. So, right now, we're going to talk about the symptoms of a very serious food allergy. These are the 5 key symptoms of an allergic illness. And it was Dr. Richard McCarness who first recognized these and published studies on them. The first would be if you are over or underweight or have fluctuating weight. That is a symptom of having battled allergies. Persistent fatigue that's not helped by rest. Um, this is often a sign of adrenal fatigue because the body is just so tired of fighting constant inflammation and working through the process of trying to fix it. Occasional swellings or pains around the eyes, hands, abdomen, ankles. These are swellings that come and go and come and go. It's not certainly not a wound or some sort of swelling that can be explained by behavior. It's just things you swell up all of a sudden. Um, and this is one of my the one I use the most because it's so easy to detect is a speeded heart rate. Sometimes it's very quick. Like if for me, if I eat a cookie or gluten, I can check within 15 or 20 minutes. Sometimes my heart rate is accelerated, and it's not related to exercise or anything. It just speeds up. So this is often a diagnostic tool of your body reacting to having an allergic reaction. And then also excessive sweating that's not related to exercise. So these are the symptoms of the severe allergic reactions. Other symptoms that might be for just food intolerances or sensitivities are endless. I don't even want to go into as many of them as there are because the list goes so long. But certainly in the GI tract, there's everything ranging from nausea and vomiting to feeling hunger when you just ate, bloating, diarrhea, constipation, or flipping back and forth between the two. In the nervous system, there's foggy thinking, memory loss, irritability, depression. And then there's also all over the body skin disruptions, headaches, achy joints, the rapid pulse I mentioned earlier. One thing that just breaks my heart when I see in children are these black eye shiners or these black lines underneath their eyes. That's just a sign that their adrenal systems are just fatigued from having wrestled with food allergies or sensitivities that nobody knows about. So when you see that, in my mind, either they've had absolutely no sleep, which is usually not the case, or they're having a reaction to some food, and of course the swelling or pain. So the main diet-wise question is, do your symptoms come and go? If you have an illness like a virus, it's just common knowledge that a virus is going to last you 7 to 10 days, you heal and you're done. You're not going to go 3 days into a virus and all of a sudden you're well, and then it comes back day 5 and 6, like that sometimes happens with food allergies. So, if your symptoms do come and go, then that could be a sign or a warning that you have some sort of food sensitivity going on. And of course, the corollary to that is if you can be symptom free on any day, you can be symptom free every day. And what that means is if you're having joint pain that keeps recurring, but then it stops and then it comes back, and it's not related to some other activity that you've done, it could very well be that you're having symptoms of inflammation from exposures that you're getting from food or the environment. Now, the next major concept in understanding allergies is understanding the concept of masking. There are a lot of people who come in and talk to me and they'll say, I don't have allergies. I don't have food allergies. I eat bread every day. I eat bread 2, 3 times a day. I don't have any reactions to bread or milk or whatever they think could be the problem or whatever we're exploring. But it's important to understand that um, allergies can be masked. And it was actually Hans Seal who wrote about this originally, and he called this the general adaptation syndrome. And what happens is when you're first stressed with a food, you have symptoms, you have reactions. And I compare this to a smoker. When if you think about a smoker, when they first start to smoke, they'll cough and feel nauseous and have a serious reaction to being exposed to cigarettes for the first time. And this happens to almost everybody. But then, if you continue to smoke, the symptoms disappear. You don't cough every time. You may have a a mild symptom, but it's nothing like it was in the very beginning. The symptoms basically disappear. And that's called the adaptation process. Same things happen with food. If you reacted and maybe didn't know that that was what your reaction, you have a headache, you don't realize it's because of something you ate, but you keep eating the food, then eventually the symptoms disappear. They're masked. That's the body's miraculous way of surviving stress. It tries to adapt and it does everything it can to adapt, and it does it as long as it can. But then eventually what happens is the body is overwhelmed. There is just complete overwhelm from having dealt with this stressor over and over and over again. And with that comes chronic symptoms or illness or finally inflammation. So, if you understand that about an allergy, that means you could have allergies that you don't know of because you eat the food so much, you don't realize that your body is masking it. So, sometimes the chronic symptoms will reappear often as a sign of craving. So if you find yourself craving certain foods, that could be an indication that your body's has has done the general adaptation syndrome parts and you are reacting to it. So let's talk a little bit about addiction and food addiction. If you're masking a particular food, um, and don't know about it. If you go without that food for a few days, there'll actually withdrawal will set in. Now, it's not usually as serious as the withdrawal that you see from heroin or um, drugs, but it can be visible. There can be headaches and achiness and irritability. So, as long as you're getting the food or consuming foods that are a part of your withdrawal, that keeps the symptoms at bay. So if you keep eating the foods that make you sick, the symptoms go away. So food cravings are a sign that you could have a food that is masked for you. And the cravings themselves are telling you that you need that food so that you can stave off the withdrawal symptoms that come when you are not constantly exposed to the food. So, what may happen is that you wake up irritable and grumpy because you've been 10 to 12 hours since you had your last meal, and that irritability is with food withdrawal from some food that has been upsetting you and you don't realize it. So, if you find yourself, or if you know of little children, you know of people who are really, really irritable when they first get up, it's the first sign that maybe you should start looking at whether there are foods that are problematic, that are unidentified, that are contributing to this irritability and grumpiness and withdrawal symptoms. So if you if the food is removed, you will see this withdrawal. So what is the solution that DietWise offers? Well, Dr. Scott Mumby has developed a protocol. He calls it a food challenge test. And through this, what you try to do is self identify. This is a proactive protocol you can do for yourself, um, to try to identify these foods that could be problematic from you. The process asks you to remove most foods from your diet and then add them back one at a time, and keep a diary and watch for symptoms, because it takes about 4 days for any food that you might have digested 4 days ago to get completely through. So this whole protocol takes about 2 weeks, but you won't be seeing symptoms for about 4 days, or you won't be able to test foods for about 4 days because it takes that long for them to clear. So in his protocol, what he discovered that ideally fasting would be the way to do this. If you take all foods away and then start adding them back one at a time, then you would know this, as soon as one hits you that is problematic, you'll start having symptoms, and you can say, "Hey, that's one of them that I have problems with." But he found in practical application that if you take all foods away, people who are really, really sensitive can have problems with adding any foods back. And that's a serious problem. So rather than deal with that, we want to start with safe foods, foods that you think are not going to cause an allergic reaction for you, and you're really playing the odds. There's always the chance that there's a food that bothers you that you didn't remove that is causing problems, and you have trouble figuring this out. So that's what makes the detective work more difficult as time goes on. But for most people, if you start with typically safe foods, and we're going to talk about what those are in just a minute, you can try to find out which ones are the worst for you. So, um, to reiterate what I just said, if you're consuming this toxic food regularly, it's masked and you don't know it. So what we try to do is remove remove all foods that are problematic, and it takes about 4 days for those to clear. And if you wait too long, and this is why we say it's only about a 2-week process, your overload can drop so low. We talked about the overload and threshold earlier, that nothing tests. So you really have a very small window from 4 to 14 days where we're going to be looking at the foods that could be causing you problems. And I want to add one thing here too. You do have to even be careful about things like vitamins, because a lot of vitamins have corn or soy based ingredients added. And if you don't take out the vitamins and you're still taking them, you might be reacting to something in those as well. So usually we try to remove vitamins and leave just a few core foods to start with, and then add to that through the 2-week period. So, according to Dr. Keith, again, the top 10 allergy foods are wheat, corn, egg, milk, tea, coffee, and sugar are all three really big ones for a lot of people. And just think about how irritable you are in the morning until you get your coffee with sugar in it, and maybe milk. Also, yeast, citrus fruits, and cheese. Now, I know a lot of you might be thinking that peanuts and shellfish and some other types of foods are also very allergenic, and they are. But in his experience, these were the top 10 that would come up over and over and over again, having worked with this for 20 or 30 years with thousands and thousands of patients. The shellfish and peanuts tended to be a smaller percentage of people had those, but these were the ones that we would ask almost everyone to take out for the 2-week period, and then save the ones that you think you might be the most reactive to last to test, because uh, you don't want to have a reaction the very first food you eat, and then you have to wait for that to clear before you can test the other one. Um, you would want to save any foods that you suspect to test last. And so the protocol for the diet solution is to add one food back at a time. And you would want to do this. The time of the day matters. You want to do it around lunchtime so that you can be awake. You don't want to try this food for the first time at dinner and then go to sleep and then maybe miss the symptom. So you would definitely want to add these back at lunch and watch for returning symptoms. If there are none, you might try a little more of the test food for dinner to be sure that you're getting enough of the food to go over your threshold. And if there are no symptoms, then you know that food's safe. If you get a reaction, then you got to wait a little while to test your next food for that food to clear and then test the next one. So the result of this process is you come up with a list of reactive foods, foods that you react to, and a list of safe foods. And then rotation is one of the key elements to minimizing the risk of developing sensitivities. In nature, if you eat seasonally, you would be rotating foods all the time. And it is the belief of Dr. Keith and some of the others before him that it is staying with the same foods over and over and over again that creates this reaction over time. And if you're rotating foods, you have a less of a risk of developing a allergic reaction. So what do you do once you find out which foods are good for you, which ones work for you, and which ones you respond to negatively? Well, if they're fixed allergies, then you may have to avoid them. And fixed allergies are defined as something that you're going to react to, even if you go 2 years without touching it. You're still going to react to it the next time. These are usually the scary allergies that require you carrying an EpiPen around with you, that do have IgG or IgE or IgA reactions, that would show up in blood tests. So you definitely want to avoid those foods. They unfortunately would have to be permanently removed because you can't risk the outcome of a serious allergy. Cyclical allergies, though, are ones that can be minimized if you avoid the food or rotate your foods or just eat them in moderation. So you can determine whether these are foods that you can have in certain situations as long as you don't go over your threshold. So in conclusions, the foods you eat can certainly be causing or contributing to inflammatory diseases. And as a unique individual, only you are best qualified to figure out which foods work for you and which foods don't. So, for practical implementation of all this information I have been discussing, DietWise was written for you to be your own advocate and find the perfect diet for you on your own. But if you want help, if you need backup, if you want to work with someone who can help you interpret some of the things that might be happening as you go through this protocol, I am here. I would love to help you with it. You can contact me at healingwithholisticnutrition.com to schedule an appointment, or you can email me at lisabest895@gmail.com. So these are some of the references that I used in putting this together. And I thank you very much for attending the webinar. So now I would like to open up for questions. Is there anyone who would like to text or chat to me a question about any of the information that we discussed, or any way that I can help you um, figure out what might be going on with your illnesses or inflammation at this point? Okay. Well, I am not. Wait. How can probiotics help? Okay, good. Good question. Probiotics and prebiotics are what we use to help rebuild the gut biome when the microbiome has been damaged by all of the things we talked about: inflammatory foods, environmental toxins, GMOs. If they have been damaged, probiotics are how you re-inoculate and rebuild the gut biome. It's so interesting that if you look, and they've done studies on this, looked at indigenous species in areas that are not on a Western diet and don't eat the same way that we do, the gut flora is like a comparison to the tropical rainforest, where there are a million different species and a million different microbes that are in their gut, compared to just a few in industrialized societies where antibiotics are so prevalently used that we keep wiping out our gut biome. And to rebuild them requires not only a diverse species of microflora, but also large numbers of them, which is where fermented foods and cultured foods come in too, to give help restore the gut biome with huge amounts of these probiotics. So that's how they help. They help rebuild the gut biome, which then dramatically affects all the systems we talked about earlier: the immune system, the gut brain connection, all of the even mental illness, mental serotonin levels, and mental responses. So all of those are greatly improved when you rebuild and support the microbiome. Good question. Thank you for it. Is gout a food allergy, or how would you classify it? Gout is a sensitivity to uh, proteins or purines. So you definitely would see it as a reaction to the food. That's why when you go on a specialized gout diet, you will restrict foods that contribute to this reaction. So it might not be an allergy in terms of getting immunoglobulin response. You probably don't see IG, IgE response to the foods that are causing that, but it is definitely related to the foods that you're eating, and they need to be analyzed and removed. Good question as well. Thank you. Okay, next question was, if we're feeling something is bothering us, should we be keeping a food diary? And if so, for how long? Keeping a food diary is always an awesome, awesome way to help diagnose what's going on in the body. Um, Not only for what you've been eating, not only for tracking what you're eating, so that you can use that as when you put the detective hat on to go back and look and see what you could have eaten that might be affecting you, but also to track your emotions and your symptoms, because you might not make the connection right away that what you just ate is what caused your headache, or that all of a sudden your joints are real achy and you didn't just run a marathon and you don't understand why your joints are achy. If you're tracking all of your symptoms, then it's easier to go back and try to say, well, it could have been this bread that I ate. Maybe I should try eliminating that and see if it works. So definitely, food diaries are always a wonderful idea. And generally, whenever I start working with patients, it's one of the first things I ask them to do. And there are so many apps now. It is so easy. You can start typing 2 letters of what you ate, and it comes up for you. So it's not difficult to keep track of what you've been doing anymore either. The technology, again, is so phenomenal that we're able to use that to um, help. Okay, what if a food allergy overlaps with an emotional problem? Excellent question. That I talked a little bit in the beginning about that. That with holistic health, it's very important to look at not only specific organs in the body, but how they all interact. And certainly, we talked again earlier about when the microbiome is damaged, that serotonin production is damaged, and that affects emotional health as well. So, if there is an overlap, it is extremely helpful to look at the emotional side as well. Um, there are folks in the practice that I'm working with now that I often refer people to for the emotional component. I also do a good bit of work myself and having to have people look into what could be the source of the emotional eating. Because there's no question about it. I can give you the perfect diet that works perfectly for you, but until you integrate it into what you're feeling, what your beliefs are, what you're willing to do, my list and my information is not that helpful. It has to be something that you're willing to do and you're willing to look at as well. So, excellent question there. Thank you. Any more questions? Okay. Well, thank you all as well. I really appreciate your taking your precious time to come and be with me today. I will probably be doing some more of these in the future if I get feedback that it's something that you want me to do. And I am grateful that you came today. Be healthy and see you soon. Bye bye.